Hi, good day to you all. Here I'll be sharing our knowledge and expertise around CEI work in Sri Lanka with a special focus on community of practices or COPs. Um, Here I'll be mainly focusing on how we organize the first COPs meeting and the local definition given for COPs, and the first COPs meeting and the engagement of the engagement of COPs members with their comments and insights, and finally the challenges and way forward that we do have. But a clear idea on what COPS is, and if we look at a broader definition on this, it will be like a key strategy to bring evidence-based policymaking and implementation by linking all actors of the system and creating a platform which they transfer knowledge, coordinate, and collaborate towards a common purpose. With this, we know that all these efforts are to have a proper community engagement and involvement, or CEI, in which the core standards are participation, empowerment and ownership, inclusion, communication, adaptability and localization, building on local capacity, as pointed out here. So we were quite considerate on meeting these standards within all our COPs and CAG activities. Okay, now we know that what the COPS is, but then to blend this concept into local context, we had to define this with a local value and a meaning. So upon discussions and agreements with the COP members themselves, we named it as the ECLIPSE Niyamana Committee, a Sinhalese term, with the meaning of some sort of regulating committee. So let's have a look at planning the first meeting and identification of COPS members. So several discussions were done within the research team to decide on whom to be included in the COPS. And so district level policymakers in health, agriculture, social services, education, and community administration as four major sectors were selected to represent different sectors. From health sector, we had the provincial health secretary, provincial director of health services, regional director of health services, and so on, including the other three main sectors as pointed out here. A bottom-up approach was used to identify a few members that would a few more members that would represent different aspects of the communities. This approach was initiated by initial community visits by the research team. For example, it was identified that CL was created by the indigenous medical practitioners in the villages. Hence, the community medical officer was invited as a COP member so that she would be able to help in reaching the key informants in the communities, as well as could influence the local level policy implementations. The research team members who work in the health sector mainly facilitated communication of the message on COPs, and all the COPs members were personally met and given an invitation, letter of invitation to the meeting. So we had our first COPs meeting on 3rd December 2020, which was a very successful event. And here is the Provincial Health Training Center where we had the event. And we had 11 COPs members and 11 ECLIPSE team members. And we had a very careful and thoughtfully driven introductory session to initiate the appropriate discussions very smoothly. And some of the key areas discussed here were like whom should be in COPs other than the team invited, and limitations within healthcare system, and about CAG's formation and how to approach the community. So now I'll take you through some important discussions, comments by the COP members within the meeting. Some pointed out their previous engagement with CL-related activities. The Provincial Director of Health Services, I would call him PDHS, mentioned that he is thankful for selecting the particular venue to conduct the COPs meeting. He mentioned that you can see the resources we have referring to the new provincial health training center, which was one of his concepts, and he devoted himself to establish that. He mentioned that ECLIPSE reminded him of one of the research studies on leishmaniasis carried out by some senior researchers when he was a student. Here I quote, at the time, the national level knowledge on the disease was very low. Even at provincial level, it was limited to research, quote ends. It never reached or empowered the villagers. He also requested the district administrative personnel to offer the fullest support to take ECLIPSE to the community. Similarly, the provincial director of agriculture told that she has learned about the illness when she was doing masters in Africa, but she never thought that this disease would be there in Sri Lanka. Here again, I quote, I understood that this is a project that runs through the community as a department that works a lot with the whole community in this province. I got to know Prof. Agampudi while he was working on the pesticide poisoning studies. It is a great opportunity to work with the team of academics with this project. So let's look at some common views on the project, as those are important to show how they want to engage with ECLIPSE and what areas they identified as particularly important or relevant. One of the medical officers of health who encountered the highest number of leishmaniasis cases in his health administrative area showed several important aspects. I quote, so here we have selected 3 communities. Are we going to work only on these communities, or are we initiating a district level program? Secondly, now this project is going to go ahead over 4 years. Do we have to wait for 4 years until the time we get the findings or decisions from ECLIPSE to act on problems that we would encounter along the course? For example, when I am practicing, I have come across hundreds of CL patients. Their journey is so long. Are we going to wait for 4 years to reduce this journey, or can we keep working on with the findings of the project as they come? Quote ends. The team identified this as a very reasonable statement, and we had to at least agree to consider this idea as it came up in a strong manner by a very dedicated, hardworking MOH known by the senior researchers of the team. The team answered these questions by explaining the fact that this is a project with CEI approach, and the COPS members can discuss and decide on prior actions that could be taken, including policy decisions, while the exploratory ethnographic work is going on. The regional epidemiologist came up with this important idea later on. I quote, the services were limited during the past few years. For example, a dermatologist is present only in the teaching hospital. Although we identify at the periphery, people are reluctant to go to the teaching hospital due to difficulty in reaching. As CL can exist as a small nodule over several years, people do not perceive it as a threatening condition. They only seek help when it is affordable. When dermatologists visited the faraway communities such as Padavia for a special clinic, we identified a lot of patients. The patient counts doubled by 2019 from the 50s to 100s. Quote ends. Also, the COP members mentioned that the term leishmaniasis is unfamiliar to the community. Many of them shared their experiences in observing this lack of awareness. And some mentioned that it would, if we are to look for the disease, we would have to go by a broader term like skin conditions. And with the progress, it was mentioned that the patients with CL are not confined to any specific socio-economic category, in contrary to the general understanding. A COP member representing the health sector came up with some of her own research findings related to the local community. She pointed out the fact that local CL patients belong to a wide age range, and a vast variety of occupational categories, including housewives and kids. Hence, any vulnerable group at risk of CL cannot be specified. Then another medical doctor revealed that he and his daughter were affected by the disease in the recent past, highlighting that it is not limited to a specific type of occupation group or low socioeconomic position. And another important view was the need for primary care level, the village level clinics to provide medical care. COP members raised the issue that it is important to conduct clinics at village level rather than usual attempts on referring to dermatology clinics at tertiary care hospitals. This will allow more patients to seek medical opinion. Hence, this approach may create more opportunities for case detection and improving the community awareness. The importance of community approach was emphasized all across. The PDHS, who was the most senior and experienced person among the COP members, mentioned that he has 29 years of experience in the field and specifically highlighted the importance of community approach and offered valuable inputs on reaching communities during the coming period. Here I quote, I get the impression that this is the ECLIPSE project, is the practice of real public health. Usually we do not practice real public health. In 1995, I worked in Yakavava village. We used a tool named participatory rural appraisal to explore social determinants of health. We did a needs assessment, not limited to health. We empower people to identify and come out with solutions for their needs. This should include many aspects, not only health. Quote end. Apart from these important practical aspects, COP members gave their thoughts on selecting CAG members as and on CAG formation. Some pointed out possibilities of using existing community networks, communities, and the importance of capturing underprivileged population with a good representation of the entire community. Here's a thought from the Ayurvedic community medical officer. Let's make sure that the people who are being left out from the village level societies and organizations are included in the CAGs. We should give them a voice. So these were some key aspects of the first COPS meeting we had, and now it's all about moving forward. The timing was quite challenging, particularly with the ongoing COVID-19 pandemic here in Sri Lanka in conducting further meetings. The heavy involvement of most of the COPS members in COVID control activities and the imposed restrictions were the key limitations in having further meetings, even virtually. However, with a possible gradual improvement of the situation, we will be arranging the next meeting. And within that, we expect to discuss the current progress of the work, challenges, and to get their thoughts on future activities, including their inputs for community awareness questionnaire that we'll be using to evaluate community awareness on CL. So that's all for the moment to share. And thank you so much. Thank you.